Welcome to the Physicians Lounge, a podcast of the Mississippi State Medical Association. The Physicians Lounge was created to provide ease of access to information and resources on current topics affecting healthcare. This episode provides an overview of mental health issues and burnout among women, focusing on female physicians. Joining us today are Dr. Paul Byers, Dr. Katherine Pannel, and Dr. Rebecca Lauderdale. Dr. Byers is the former state epidemiologist with the Mississippi State Department of Health and currently working at the University of Mississippi Medical Center in Preventive Medicine in the School of Population Health. Dr. Pannel is a psychiatrist and medical director for Right Track Medical Group in Oxford, Mississippi. She is certified by the American Board of Psychiatry and Neurology. Dr. Lauderdale is a board-certified internist practicing with Hattiesburg Clinic in Hattiesburg, Mississippi. Thank you for joining us.
Welcome to the Physicians Lounge, a podcast of the Mississippi State Medical Association. My name is Dr. Paul Byers. I'm the former state epidemiologist at the Department of Health and currently in the Department of Preventive Medicine in the School of Population Health at the University of Mississippi Medical Center, and the host of the Physicians Lounge podcast. We have partnered with the Women Physicians section of MSMA to drop a special podcast series to observe and celebrate the 2024 National Women's Health Week. National Women's Health Week is a program brought to us by the U.S. Department of Health and Human Services Office on Women's Health. This observance aims to highlight women's health issues and priorities, as well as encourage women of all ages to prioritize their physical, mental, and emotional well-being. For more information about National Women's Health Week, visit the MSMA website at msmaonline.com or Office on Women's Health at womenshealth.gov/NWHW. Today, we are talking about women's mental health and burnout, and especially as it applies to our female physicians in the state. And I'm joined today by Dr. Rebecca Lauderdale and Dr. Katherine Pannel. And so first, let's go to Dr. Pannel. If you could give us a little bit of information about what is physician burnout, what is burnout in general, and give us a little bit of background information on that.
Sure, and just first of all, thank you so much for having me, Dr. Byers. I'm really excited to be here to talk about such important topics. I'm a psychiatrist in Mississippi, board member of the Mississippi Medical Association, but I'm also a part of the Mississippi Physicians Health Monitoring Program, so I kind of see it from all angles, with physicians. And, we're coming off of COVID. COVID was pretty terrible. I mean, COVID's not gone, but it is a lot better. But one of the positive things I think about COVID is that it has really brought mental health and physicians more into awareness. Decrease the stigma a little bit so that we are talking about it. I mean, I can't imagine that there would be a podcast prior to COVID talking about burnout and physician mental health. And now we can talk about it freely now, so I'm excited to be here.
The pandemic certainly brought it to
Absolutely.
Everybody's radar. For
you
sure.
got to find a positive out of everything. And so that's how I've seen it, is that, one thing positive is that, yes, we are talking about mental illness more. There's such less stigma. People are talking about it. They're seeking treatment more. And it's more important now than ever because physicians, up to 70%, are reporting, symptoms of burnout. So it's great that we are now paying attention to it and really trying to search for solutions. And I think it's important to, for colleagues, for ourselves as physicians, to kind of look at it and identify the symptoms. Once acknowledging the symptoms, we can find treatment for it. And, with physicians, if you're looking for somebody, it's just acknowledging that your colleague seems more distant, more irritable, more isolative. Notice that they are lacking empathy. They're not caring for their patients as much, feeling as though they're a failure, and just, noticing that the relationships they've had are once deteriorating. And I think once we can really target in and notice the symptoms and acknowledge the symptoms, that's where really good treatment comes in.
So it's important for us as physicians to look at our colleagues,
Absolutely.
to try to recognize this in our colleagues, right?
Recognize without judgment.
Right, absolutely. So from the perspective of trying to help,
Absolutely.
to point it out, to shine a light on it, and let's start working towards getting a solution. How do we do that in ourselves? How do we recognize that we may be experiencing burnout or getting close to that edge?
And I think that probably is the most difficult part of all of this. You became a physician, it's altruistic. You're not supposed to be weak. We are there to treat others and not take care of ourselves. And oftentimes it's brought into the light by our loved ones that have noticed that difference. But I think for us, when we start noticing that when we're serving that role, if we notice that we're not getting notes done in time, we're not sleeping as well, we are becoming more irritable with patients, with family members, or we're wanting to stay in bed more, we're not wanting to do the things we love, or we, at the extreme end, we're starting to make medical errors, that's when we need to take a step back and really evaluate what's going on.
And, that can be a difficult challenge. Are there resources? What would be that first step for if you recognize it in yourself or you recognize it in a colleague of the potential for burnout or stress? What are the resources? What are the next steps?
So, and we're oftentimes very hesitant to even go that next step. We're worried about retaliation, losing our job. Even if we want to go see the local psychiatrist, where's the back door? Because we don't want to see others in the community seeing us going for mental health treatment because they may not think we're equipped to treat them. But there are great anonymous resources. And I know we have a national physicians hotline that is staffed 24/7 by psychiatrists, no fee, no identifying information. They are there just to help with physicians that are struggling to get them through a difficult time.
And just speaking as a physician as well, a lot of times you don't want that information public. You don't want that information, even the folks that you work with, to even be aware that you're seeking help.
And that's so sad. I feel like if physicians told their stories more, if they reached out, I think that again would go a long way in breaking down those barriers as walls, decreasing the stigma. But we still have a long way to go. Physicians are still, rightfully so, because we've got a long way to go, just worried about job security and who is going to get this information. But the National Physician Hotline is, like I said, 100% confidential and free, and you can call and talk to a trained psychiatrist about what's going on in your struggles, and they can help guide you further.
That's great information. So, Dr. Lauderdale, let's talk a minute about some of the data that you've shared with me before about what we're seeing as far as burnout and what we're seeing as far as that specifically with women physicians.
Yeah, so this area is something that I'm passionate about because I've had my own experience of burnout, and some of the things that Dr. Pannel just said about how we tend to not want to let anyone know what's happening to us were very true for me. And so that's the reason I know these numbers, is because once I finally realized what was happening and that it had a name and there were other people who had been through the same exact thing and that there's actually something to do about it, I wanted to learn as much as I could so I could tell other doctors and help others. So what we know since we started measuring burnout in physicians back in the 20-teens is that it seems like there's a floor percentage of burnout in physicians, of prevalence of it at any one time, of around 30 to 40%. That number has risen since the pandemic. It came back down just a little bit the last couple years, but we're still sitting around half, somewhere between 40 and 50% of physicians, depending on what they're...
Can I ask you real quick, how does that compare with non-physicians? Where does
the general public?
Yeah.
It is substantially higher.
Wow.
Substantially higher. And one of the things that we know about physicians is that we're resilient. There was a lot of talk, especially during the pandemic, not just with physicians but the general public, about building resilience. And in some ways,
that's something we talked about a lot. For sure.
Yeah, so resilience is a good thing, but we know that some of the ways that we define and measure resilience don't necessarily take into account all of the healthy behaviors that someone who takes good care of themselves would participate in. And so when you have groups of people who are highly resilient, like physicians, like military special ops, like EMTs and first responders, those groups of people also have higher than average burnout scores. And so it doesn't really follow that it's resilience so much that we need to improve burnout. And what it turns out to look like, at least part of the answer, is how we value ourselves. It's a concept called self-valuation. And unfortunately, physicians don't score very well on self-valuation. And that's questions like taking care of your own needs, regardless of, we tend to prioritize patients and others' needs over our own, regardless of urgency or importance. And so we also tend to be very critical of ourselves. We tend to expect perfection and excellence from ourselves, and not give ourselves the grace that just being a human being requires. And so those things actually contribute to our burnout, the fact that we don't do those things well. And so when you look at the behaviors in the general public and physicians, if we were to get better at those things, then we might have a lot better burnout numbers.
And, self-valuation is so important. And I recognized some of those things that you were talking about as you described it. But it's that lower self-valuation may be even more pronounced in female physicians, especially when we think about some of the additional responsibilities that married women doctors will take on, that may even be expected or unrecognized.
And that's definitely something I've had personal experience with. But yes, there have been studies that have shown that women physicians who are married compared to men physicians who are married do somewhere around 9 hours more of household tasks, kind of caring tasks outside of work every week compared to the men. And that's even when it's a 2-physician household. There's not an equal sharing of household duties and household tasks. And while I don't have numbers for women who are not married, I imagine those are similar. We have parents who need caring for. We have things at work that we get voluntold to do, and we know that women are more likely to be asked to do things that don't lead to promotions, that don't necessarily lead to building the kind of skills that would help us to advance in our careers.
And I'll jump in too. This is not like bashing the physician husbands. I've got a physician husband, and well, I think he would be willing to jump in more. It's almost like a mom guilt thing for me, that I feel like, no, I've got this. Part of it is
very cultural.
Absolutely, yes.
Yeah, we get socialized to see and expect women to do certain things, and so when we grow up and we have our own careers, we try to do all those things, and not really realizing that there's even a possibility of doing things differently. And so, one of the things that's been really interesting to watch over the past few years is the development of different systems and ideas of thinking about unpaid labor and invisible labor and emotional labor, and what those things mean and how to equalize them. And there's a really, really cool, a book written for the lay public called Fair Play that talks about this. And they have a deck of cards that have every sort of task you can imagine. And you sit down with your partner and you go through the deck every week, and each person takes cards. This is your responsibility, this is mine. And it helps level the playing field. And usually, there's one person who may have more cards, but you're agreeing that this is how things are going to go. And so it takes a big adjustment. At
least some acknowledgement of who's doing what, right?
Right. Yeah.
And I was thinking about, that the thing that popped into my head as you were talking was nurturing, and it sounded like there was such a desire to nurture those around, but not a recognition that you need to nurture yourself as well.
Right. And I think that's really the core of it, because we truly can't care for other people any better than we care for ourselves if we're looking at things in the long term. So we have to care for ourselves in order to continue to be able to care for others. And that's a hard lesson to learn, because at first it sounds like a cop out. It sounds like somebody just made up a nice thing, that's not true. But it is true. And
right.
Yeah. So I think more of us just need to talk about it.
So if I could ask y'all both, how do you feel like this translates into provision of care for patients as well? Because, we've got to be able to take care of ourselves to be able to do appropriate care for our patients. What do you think, Dr. Pannel?
Yeah, I heard when I was researching and getting ready for this podcast, I heard a great thing that said, while physician burnout, it manifests in physicians, it originates in systems. So, I mean, I think we have to really, look at our systems and the way we're doing things, and look at things like, admin burdens, which that means EHR burdens, frontline risk, and just, we need systems to also support physicians, and that means making it okay for them to take that time that they need, as Rebecca said, for self-care, because we are not going to be able to give the best care to patients if we ourselves are not taken care of. So I think this, not only is it something that we need to look into and look at physicians and what they're going, but it's also a systemic issue as well.
Agreed. Dr. Lauderdale?
Yeah, so I think we know that burnout is a syndrome of occupational stress. It happens because of persistent exposure to high emotional and physical demand situations where there's often not enough resources to cover the demand. And so there's a woman, her name is Christina Masloch. She developed the Masloch burnout inventory that everybody uses in every profession. She's studied this for decades now. And part of her research was figuring out what contributes to burnout. And there's 6 areas of work life: the workload, the amount of autonomy, the amount of compensation and reward. And that's not just money, but it's also recognition. The community at your workplace, how fair things are, and how much you share your values. And those are 6 really good places to get started with figuring out what we need in our own systems, in our local systems, as well as our larger systems. And I think enough of us advocating for this will make a difference. But the things that we can do in our own practices probably have a lot to do with workflow. And they do have to do with, EHR usability.
That stresses a lot of people out.
Oh yeah, apparently, studies now show that 50% of the physician workday is spent dealing with EHR.
Oh yeah.
That should be, that's egregious. It should be 50 and plus spent on patient care and 10% on EHR. Yeah.
And I think that, one of the things that we've been doing at Hattiesburg Clinic, some of my colleagues have been piloting AI technologies that act as scribes, trying to continue to use technology, hopefully to get us over that hump from where the EHR is making things harder to where the EHR actually starts to make things better for us. And so I've got some hope for that in the next few years, maybe becoming something that really will help improve our workload. I hope that what that means isn't that we all just try to double our schedules. Like our patient panels. Right. I don't think that's the way to respond to that. I think we need to learn what an adequate workload truly is, and then compensation and reward, again, not just being money, but being care for each other. And a lot of us are so busy and we get burned out that our connections with our peers and our friends start to suffer, and we forget how much work sometimes it can take to maintain friendships and collegial relationships, but how valuable they are.
And that's just to hit on that too, in looking at all this, that's another area where I wish one of the things that hospitals and systems could do that's an easy fix is bringing back the physician lounge.
Yeah.
When I first started practicing, gosh, it's 10 years ago now, like I remember there being a doctor's lounge where you could go and they had little snacks, but it was more of a time where you could sit, have conversation with colleagues, kind of vent, talk about patients, and now they're all gone. But just bringing back something as simple as a room dedicated to physicians where you could come in and actually see colleagues and, connect on a personal level, say, how is your family? How are your kids doing? How's your wife? Just that connection, I think, has been really undervalued and lost. I think just bringing back that, physician relationship would be huge and decreasing physician burnout.
Yeah, we've done physician dinners modeled after the Mayo Clinic studies, where you get small groups of physicians together and you just meet together once a month, and you might start talking about a well-being topic, or you might not. The studies show it doesn't really matter.
And
it just helps to get together and spend some time having a free conversation.
I'm struck with the fact that we also used to do physician dinners, and we had physician lounges, and I don't think at the time that we recognized that those sorts of activities were a support network. And when you do away with that, it takes a little while to realize the hole that you've left. So for the physicians who are across the state, whether they're men or women physicians, certainly they can experience burnout, and they're listening to the great information that y'all are providing them today. And I'm sitting here and I'm thinking, okay, I can recognize this. I have burnout. What do I need to do? Because it sounds like some of the things that are described, I may or may not have control over. I may not have control over the patient flow. I may not have control over some of the issues with the EHR. What do I need to do at this point?
I can start. You can either way.
Yes, I would love to hear what you.
No. I mean, it's a great
What you
question, and
suggest.
I feel like it's a multi-pronged question. But great, you've acknowledged that there's something going on. You've reached out to colleagues; they have supported you, and then I mean, I think if the physician outreach online, if that is something that's not helping, you got to look at your local resources, and reaching out to a psychiatrist colleague and seeing if can they point you in the right direction, whether it's therapist or look, if you're worried about stigma, I've escorted many a doctors through the back door of my clinic. Happy to do that too. But it's all about, like, whether it's therapy or being with a psychiatrist, you may need a medication that if it's something clinical, depression, anxiety, bipolar, whatever. But it's also, with therapy, going through the pros and cons and deciding lifelong, is this something too that you're willing to stick with? I mean, it's all about the adverse versus benefits. You have to decide what's best for you in the long run. But yeah, just knowing that there are resources, whether it's online, the 988 system in our state is great. That's also confidential. Finding a colleague that can steer you in the right direction, but ultimately it's weighing the pros and cons of what do you want out of life.
Dr. Lauderdale?
I think
while advocating to change all the negative.
Right.
Don't stop advocating.
Don't give that
Yeah,
up.
right.
Gotcha.
Yeah, I think that the answer really does have to do with how burned out are you.
Yeah.
Right.
If depression runs along with burnout, they're not the same thing, but they tend to trigger each other.
Yeah.
And so if you have depression too, you've got to seek treatment for it. And if that means going outside of your town, telehealth, whatever that means for you, get that help. Talk to your primary care physician, and if you don't have one, start practicing self-evaluation and go get one.
But that is something that Dr. Byers and I talked about before we got on, is that it's sad though that you have to tell your colleague to go do telehealth because you have to hide, or I need to get you in through the back door. I mean, there's other things, and that's why I just kind of inserted that while continuing to advocate, because there's still so many antiquated things that we can change. Like, you shouldn't have to worry about it. I mean, I understand the point of you not wanting the community to see you walking in to a psychiatric clinic, but there are things as physicians that we can do to eliminate that anxiety about going to seek treatment. And there's things like malpractice applications and board licensure applications and state medical licensure applications, that there are certain questions that have to do with mental health that keep physicians from seeking treatment that I think we could advocate to do away with. Many states have. Mississippi has started it, but we've got a long way to go.
Well, our medical licensure no longer asks those intrusive
I think
questions,
that's so
and they're
awesome.
one of the very first to remove it. The Corey Feist, who's the brother-in-law of Lorna Breen, who's the ER physician that committed suicide during the pandemic, and that Lorna Breen Act was signed into law that provided a lot of resources for healthcare workers. He talked about how, she didn't know that she couldn't have lost her license just simply because she was being treated for burnout and for depression. But one of their, he acknowledged that Mississippi and like one other state, I think at the time, had removed that language. But we still have that language in our malpractice insurance applications and many other credentialing applications in hospitals and other organizations that we have to be credentialed for. Have that question about, have you had any treatment for any psychiatric disorder? So does that mean my antidepressants that I'm getting from my primary care? That means yes, I have to answer that on my questionnaire. And those are things that deter physicians from seeking help. I remember being terrified, absolutely terrified, that somebody would find out that I was depressed and burned out. And what would happen if somebody, if a patient found that out and something happened, that they could take advantage of it. And ultimately, I realized that getting treatment for myself was the only way I was going to get out of it alive. And it is really sad that it has to get to that point where some of us feel like we can actually seek help. So I don't know, I'll just take this opportunity to say, don't let that happen to you, but we understand why it happens. And so if you need to talk to somebody and you don't feel like you have somebody, sometimes it's a peer. If you if you have a peer that you can talk to, if you know somebody who's been through something similar, sometimes that's the best way to get started. And there's sometimes the anonymous things too, like you mentioned, the doctor hotline, just being able to stay anonymous. Sometimes that will help you begin to talk. And as you begin to talk, you get a little stronger and start to understand you're not alone. And then that allows you to take bigger steps. So sometimes it's that tiny little step where you even are staying anonymous. Just go ahead and do it.
I feel empowered by both of y'all just from listening to this. I mean, this is great information. And as we think about National Women's Health Week, one of the key points to health in general is practicing self-care, is deep breathing, is staying active, is reaching out for support, seeking professional help when you need it. And it sounds like that both of y'all are certainly advocating that we don't hide this away. If you're having these feelings, talk about them. Find a support system. Don't just brush it aside. And I think that this is some great information as we move forward. And don't forget that the Mississippi Physicians Health Program is available as well. And if you're a doctor who is struggling, and it doesn't matter what the struggle is, you can reach out to them. If it's alcohol or drugs, certainly, or impairment, this program can help. It's helped many physicians continue to practice and get back on their feet, and encourage physicians to reach out to those alternatives as well.
I was just to say, I serve on many boards, many advisory boards, and I have to say that I think MPHP is probably by far my most favorite board to serve on, because it is a board that is committed to helping physicians, help them keep their license, help them to practice to the highest of their ability healthfully. It is a great program, and they will guide you in the right way without judgment. Absolutely non-judgmental.
Final words or final guidance as we move forward.
And I just agree and echo what Dr. Lauderdale said, that as a physician, it is okay not to be okay. There is help out there, and without retribution, you're not going to get anywhere without help. I mean, it's just one of those things that is going to continue to pile on, and until the point where you are going to make mistakes, where you are going to be at risk of losing your license. Don't let it get that far. You can get care without judgment, and it's okay. It is okay not to be okay.
I love that.
Yeah. And I think there's a newspaper, I think it's the Washington Post, I don't remember, but their slogan is "Democracy dies in darkness."
Shine a light on it.
Our well-being dies in darkness.
Yes.
If you're struggling and you keep it all into yourself, it's not going to get any better. And also that we get happier as our careers progress. Like that's just statistics show we get more satisfied as we progress in our careers and our lives. So if you're in your 30s, in your first decade of practice, and things seem really hard and you're like, there's no way, I can't keep doing this, it does get better, but you have to actively participate in that. And so just talk to people who are safe. And it can get remarkably better. You can thrive, you can flourish. I believe all of us can, but we have to talk about these things in order to find solutions.
Wonderful. Thank you both.
Thank you.
Thank you.
Thank you for joining us. Show notes for this and MSMA's other episodes are on podbean.com or on msmaonline.com. Support our show by subscribing and leaving a review. Thanks for listening, and see you next time. Brought to you by MSMA. We are the physicians who care for Mississippi.